Good morning, everyone, or good afternoon, depending on what coast you are on. I am Jenny Bogard, and I'm the Executive Director at the National Hypertension Control Roundtable. And we are delighted today to have our friends and colleagues from the CDC Foundation join us to give us an overview of the Hypertension Bites campaign. So, with me today is Kinetra Joseph, a senior advisor at the CDC Foundation for Social Impact and Behavior Change Programs, and Mandip Kaur, who's a senior health communication specialist at the foundation. We are going to dive right in, and just so you all know, you will have an opportunity to submit your questions and come off mute later today on this fireside chat. If you have any burning questions you'd like to ask the two of them around the Hypertension Bites campaign. So, with that, I'm going to dive right in. Kinetra, what is Hypertension Bites and what contributed to this campaign?
First, I do want to say good afternoon or good morning to everyone, depending on where you're joining from. And Jenny and to the National Hypertension Control Roundtable, thank you so much for having us. Um, your question, what is the Hypertension Fights campaign and what informed it? Before we begin, I do want to acknowledge that this campaign is part of the Hypertension Control Alliance, which is a group assembled by the CDC Foundation with initial support from AstraZeneca, whose early investment reflects a commitment to uncontrolled hypertension, a commitment I know that we all share here in this meeting. And then all of the content that we'll be sharing, all of the research insights, has been reviewed by and developed in collaboration with our esteemed partners. So thank you to the American Pharmacists Association Foundation, the National Forum for Heart Disease and Stroke Prevention, and the Preventive Cardiovascular Nurses Association, along with we were pleased to have Dr. Yvonne Commodore Mensah and Dr. Yolanda Lawson uh, uh, you know, serve as advisors, bringing their clinical expertise to this work. Right. So your question, what informed it? I'll share that the campaign didn't happen overnight. It is deeply research informed and evidence based. For about a year, we reviewed 57 peer-reviewed and gray literature articles to understand the landscape, and that allowed us to assess trends in hypertension prevalence and mortality, barriers and facilitators to control, as well as effective communication frameworks for this issue specifically. And then over the course of that year, we most importantly centered the audience through formative research, message testing, creative testing, and final materials testing. We engaged nearly 500 US adults who had diagnosed self-reported uncontrolled hypertension. We did that across nearly 30 focus groups. And in addition to that, we fielded an online survey of about 386 adults, also with reported uncontrolled hypertension. And every decision that we made was shaped by what we heard directly from people living with uncontrolled hypertension. So that's a little bit about what informed it, where that led us, where that journey led us based on the data about in our assessment of potential audiences. We ultimately decided to center US adults in that 35 to 54 age range who have diagnosed uncontrolled hypertension. And so what I'll share is that while this campaign is intended for all audiences, all adults, if you will, and is relevant for and accessible to all adults, it has been primarily shaped by insights from adults over 40. So older millennials and Gen Xers. And so as you look at the creative look and feel of the campaign, you will see, especially if you're from the generation, a 90s inspired creative approach that was intentionally selected by the audience as something that resonated most strongly with them. All of that led us to Hypertension Bites. It's designed to meet people where they are in real life to respond to the realities, the frustrations, the distractions, and the competing priorities that can often get in the way of blood pressure control. And our hope is that it delivers a clear message that control is possible, that it starts with um, knowing your numbers and making a plan that fits your life. So before we proceed, I want to share the campaign essence video. I know we have several partners here who have seen this, and some who may be new. This really reflects the essence of the campaign.
You've perfected the art of the shrug, the eye roll of indifference.
Whatever.
The small stuff is that, small. But high blood pressure, or hypertension, is different. It's danger. It's a call to act, because it's slowly doing damage beyond what you can see. Hey, you've been dealing with it the best you can, but you can always do better. Because hypertension is more than a heart condition. It can cause heart attack, stroke, even dementia. Dealing with it sucks, but you've been here before. So you'll do what you have to do. You'll seek treatment, track your numbers, and make changes for a healthier lifestyle. To be there longer, for the people who matter. There's lots in life you can ignore, but not hypertension. Hypertension bites. You've perfected.
I love that video. Thank you so much for sharing that, Kinetra. It just resonates so well with myself and love to get it out. So, question for you all. What did you learn from the research? I know, as you mentioned, you spend a lot of time really getting it right and talking to the right individuals and researching and understanding what really will move the needle. So, what did you learn from that process?
There were a few things that really surprised us. When we began planning this campaign, we started with an assumption that the primary challenge is awareness, that people simply don't know that high blood pressure is serious. And our research ended up actually challenging that assumption. What we found is that most people we heard from and in our research already do know the basics. They know that high blood pressure is serious. They know that it leads to heart attack and stroke is scary. But there's a general awareness, stroke in particular was scary, but there's a general awareness of those risks. They know that healthy lifestyle matters for reducing their risks, and in many ways carried a good deal of shame about maybe healthy lifestyle habits that they weren't practicing and how that might be impacting their risks. And they're generally aware of what is a normal blood pressure reading, that you should be around 120 over 80, that's normal. So the challenge we found is not simply awareness, it is helping people translate that awareness into action. And one of the biggest insights from the research is that that awareness alone does not necessarily lead to behavior change. We recognized that there are these areas, while there is awareness, there are still many places where there was not knowledge. Many still didn't know their own numbers. All right, so they knew someone had told them, either a healthcare professional at some point, that they had high blood pressure or hypertension. Some noted that it ran in their family, but did not have a sense of what their own numbers were. Many didn't understand what control actually means. And this was a significant finding. When we asked, what does it mean for your blood pressure to be under control? We generally received answers that connected control to a feeling. So I'll know if I'm under control because I don't feel any symptoms, or I feel I'm under control because I'm practicing the habits, or my actions are an indicator that I've achieved control. But very rarely, if at all, was control associated with a destination or a number. We found that there were subsegments that were delaying action because of that not that awareness of their numbers, of that felt risks, and that many felt overwhelmed and life would get in the way of their action. And lastly, a significant finding is we found that while many were aware of the relationship between high blood pressure and heart attack and stroke, there were conditions that were surprising. So there was limited awareness of the relationship between high blood pressure and dementia. Certainly also for kidney failure or quality of life impacts like their sexual health or vision. When we explain these connections, in particular dementia, we often heard and observed clear, stronger reactions because people hadn't heard this before. One other thing that we found, an important finding, is there's no such thing as a single hypertension audience. So this is not a homogeneous group. We were able, through our research, to develop 5 distinct personas that reflect the various perceptions of threat, motivators, barriers, and needs in this population. And so we found some are unconcerned. So that's a distinct persona. Because high blood pressure doesn't have symptoms, or because of the challenges or the demands of life, there is not a level of concern at this point with this particular group. There's a group that's very skeptical of the actions that we're proposing to achieve control. So there's a group that's particularly skeptical of treatment and has an overemphasized sense of their ability to achieve control on their own. There are those who are aware of the threat, who are aware of their condition, but are variable in their ability to stick to actions and or are discouraged about their path to control. They've tried several things and they still have not achieved control yet, and there's some discouragement there. And then there are finally those who are re-engaged, they're motivated, particularly because maybe they experienced an event or had a wake-up call with someone really close to them. And so we recognize that not all patients are the same.
All right, I'm up again. So, what are the barriers to patient action? You mentioned some of the skepticism around them just being aware of their own blood pressure, and everyone kind of sits on a different position within the behavior change model. So, what were the barriers to actual having patients activate and have some behavior change around just beyond just awareness around their blood pressure numbers?
Great question. So we found a couple things that kind of we group the barriers. There's kind of 4 categories. One are the emotional barriers, and we know from our experience that emotional drivers are often the strongest drivers of action. And at the same time, those emotional barriers are also really strong. And important for us to find the way to acknowledge and empathize with some of these barriers. We heard over and over, life can be hard. So you've heard me speak to the reality that all of us, we're navigating these decisions within the context of life. And in particular for this age group, and when I say this age group, I'm raising my hand. The age group is me. I am, so that's me. People are managing work, caregiving, finances, countless competing priorities. For many people, hypertension wasn't ignored because they didn't care. It was simply one more thing competing for attention. Other emotional barriers, so the fear, the frustration, maybe shame. You heard me speak to this. If there's awareness that lifestyle influences this condition, then that kind of leads to some shame about this. This is a condition that exists because of something that I'm not doing. And that's why fear-based messaging alone especially can backfire. People need urgency, but they also need hope. Other barriers, practical barriers, even highly motivated people face practical obstacles, time, cost, for some, transportation or childcare as it pertains to the actions that we're asking them to take to lower their risks. So many people know what they should do. The challenge is figuring out how it fits into real life. And so that reinforced the importance of making recommended actions feel realistic, achievable, and worth the effort. One of the most interesting findings with regards to barriers involves what we call the mental model. So these are the beliefs that people carry that shape how they interpret information. We heard statements like, I feel fine, it runs in my family. Also, this feeling again that I should be able to fix this with lifestyle alone, I'll deal with it later. Um, this last one in particular around stigma about medication, which we know that for most people, treatment is an important part of their control plan to achieve control. So even if you understand the urgency and how it affects you, it is more difficult. And data show that most people are going to need some treatment as part of their plan at the same time. The resistance to that was pretty overwhelming and consistent in the research. And what was interesting when we think about mental models is we saw people viewing medication as a personal failure, like as an indication that, again, to the shame, I did something wrong, there's something I didn't do, and this is the result of that. So that's one. And then importantly, seeing it as a decision that is in opposition to healthy lifestyle. So consistently, the framing is it's either lifestyle or treatment. Whereas we know from the American Heart Association, American College of Cardiology guidelines that it's actually lifestyle and treatment if your doctor recommends it. So that's an important shift that we need to make from either or to both and. And finally, we did hear about some of the barriers that exist within the healthcare experience itself. I'll admit this was noted, but not as prominent a theme as a barrier, but it's certainly something to note, um, uh, particularly as it pertains to past experience, right? So the healthcare system barriers as experienced through interactions that folks have had with healthcare. So there was conversation about distrust, rushed appointments, maybe a negative experience in the past, not knowing the questions to ask, or maybe showing up and healthcare professionals themselves not prioritizing or speaking to this. So there's maybe an experience there that we heard. And so the campaign can't directly address these barriers in and of itself, but it can consider that challenge and help patients feel prepared, confident, and supported when they are showing up for their interactions with healthcare professionals.
So we just heard the barriers, but what did you find that motivates patients to be more engaged around knowing their numbers and doing something about it if they do have high numbers when they take their blood pressure readings?
So a few things, and you heard me speak to this. One being finding an opportunity to break through the clutter with information that feels or lands as new to the audience. And so we found it motivating and impactful to acknowledge the seriousness, absolutely, but to move beyond the seriousness with something that people don't always realize, and maybe starting with that. So some examples of this, as I noted, are the clutter-breaking reality that high blood pressure can increase your risk of dementia. So if that's something that's new, um, perhaps it's that it's more, it's attention grabbing in and of itself than heart attack and stroke. or it's more that I didn't know that. And so because it's not something that I already knew, it grabs my attention a little bit more. Similarly, the impact of high blood pressure on quality of life, conditions, things that would affect your quality of life, like the relationship on your vision and your sexual health. One other thing that we note is, folks are generally aware that 120 over 80 is normal. You will see that we are communicating a lot more that 130 over 80 is the point where you need to be, where you may have a problem, right? So ideally, you want to be below 130 over 80, ideally closer to 120 over 80, but you'll see in a lot of our content, because it's maybe lesser known, if you're consistently higher than 130 over 80, you have uncontrolled hypertension and you may be at risk. So that means if you are thinking about the readings that you had, when you went to the dentist per se, or if you are measuring at home, that's an indicator or a trigger that there may be a threat. Another point to motivate action is, yes, communicating urgency. So there's seriousness, which is a threat, and then there's urgency, which is to show not only why it matters, but why it matters now, not someday, not in the future, and to connect the experience with your living, not just your threat of dying, right? But you'll notice we're speaking to conditions that affect your quality of life. So one, what you do now matters. This is something important to focus on now, and it influences your quality of life. So some examples from a messaging standpoint, we're always communicating good news, control as possible. And there are many conditions that can feel scary because there's nothing you can do about it, or you don't know. And this is good news. This is a condition where there is something you can do about it. And what you can do works. Control as possible. So that's good news. And there's options for a plan that, can fit your life. You'll hear us talking a lot about control plans. You'll see messaging a plan that works for your situation. What works for Jenny may not work. It may be a different path for Kinetra, but the good news is there are options that work for us. We found in our research, this line in particular, the second bullet, it's causing damage now that you can't see. We saw in message testing that was chosen as an effective way to communicate things that we're communicating, like it's a silent threat, right? But when we say, guess what? It's doing damage now. It's already happening that you can't always see, was a way to really speak to the silent threat of uncontrolled hypertension and the urgency of it. Again, that it impacts your quality of life now. Good news that staying below 130 over 80, ideally closer to 120 over 80, that's going to reduce your risk of these serious conditions. So good news, control is possible. Something specific, if you can stay below 130 over 80, that's where you want to be to lower your risk. So we're not just communicating the threat, but we're giving a specific connection to living and we're offering some hope. And then that takes to this last point. So something that lands as new, something that lands as urgent for now, and having a positive benefit for you starting now, and then offering specific steps that don't feel generalized here. So you'll hear us, you'll see in the content, and you'll hear that we speak to make a plan with a healthcare professional. So that's a very specific thing we're proposing quite a bit. And we're proposing that you do it to keep your blood pressure below 130 over 80. If we know that control can feel nebulous, we want to over communicate. Where you control means staying below 130 over 80, make a plan with a healthcare professional to get there. We talk about a control plan. So everything is a control plan. We say, for most people, the best plan includes three parts: measurement, consistent lifestyle habits. So habits that you can, that can be consistent for you. I can have very aggressive lifestyle habits in my plan that are not real for my life. So it needs to be something that I can do consistently. And treatment, if your doctor recommends. So we're using the plan framework to try to help get at this idea of either or, to say, hey, for most people, the ideal plan includes three parts. And so it's not just you. This is very normal. You want to be measuring regularly, find lifestyle habits that work for you, and treatment if your doctor recommends they work together. And then we also want to speak in terms of small steps. Not people are feeling overwhelmed. We don't want to, speak that you have to go from 0 to 100. So small steps add up, like taking your medication as prescribed, checking your blood pressure regularly, and finding a way to reduce your sodium.
So you shared the barriers and ways for patients to be activated, but how do these insights actually shape the Hypertension Bites campaign?
So yes, thank you, Jenny. Hello, everyone. Good morning and good afternoon. Thank you for having me. I'm Mandip again. So as far as insights shaping Hypertension Bites, so based on the insights that we did find, the campaign is designed to help address many of the barriers that Kinetra mentioned earlier. So one focus area is to help explain the risks by making the consequences of uncontrolled high blood pressure clearer. And this is including risks that audiences told us stuck with them, like dementia, we mentioned earlier, impacts on sexual health, vision, stuff we mentioned earlier. Another focus area is to help define control by clearly communicating that blood pressure control actually means reinforcing 130 over 80 as a goal. And then the campaign also works to give hope. We know many people feel overwhelmed. We talked about folks feeling discouraged when it comes to blood pressure control. So the campaign emphasizes that control is possible and that small actions can make a big difference. And then, of course, helping to share the plan. We just mentioned the plan by promoting a simple framework, measurement, healthy lifestyle habits, and of course, treatment when recommended by a healthcare professional. And finally, we help to address barriers like treatment adherence is an example. But we want folks to trust the steps and make them work in their real life. So this is, again, not about perfection. It's about clarity, it's about partnership, and it's about helping people move from awareness to action.
So, what resources are available for professionals? I think most of us on this call today either work in communities and see patients or focus on hypertension control in the communities we serve. So, what can everyone on this fireside chat access in terms of resources to engage individuals around better blood pressure management?
Yes, this is the fun part. So we'll start with our talk pressure guide. The talk pressure guide is basically our messaging foundation for the Hypertension Bites campaign. It has practical, easy to use messages that help people understand their blood pressure, help them feel confident about managing it, and also to take small steps towards control. And this guide was intentionally designed to be flexible. It can be used in one-on-one conversations with patients. It can be used in group education sessions, clinical settings, community-based environments. So it can be used in a lot of different contexts, and that's the beauty of it. So whether you're a clinician, a community health worker, pharmacist, partner organization, you have the language that's ready to use that keeps messaging consistent and accurate. And then for your channels, we have a series of PSAs. These come in different lengths. We have 15 seconds, 30 seconds, so very flexible again. So these PSAs are available in short versions that are optimized for digital and social platforms. So you can use across Instagram, Facebook, various platforms. They're designed to grab attention, to be relatable, and they're very easy to share across share across touch points. So that means social media, it can mean websites, presentations, email newsletters, paid advertising. So, really they can be plugged in many different outlets. And these videos feature two individuals living with hypertension. We refer to these characters as Jean on the left and June on the right, we have here. And in each story, we see them dealing with everyday life mishaps, such as like spilling coffee, minor accidents, small inconveniences. And they simply, shrug these mishaps off. It's meant to be relatable, it's human. But then we see a turning point. During a visit with their doctor, they learn how serious their uncontrolled blood pressure really is. And that's not something to ignore or brush aside. So these are kind of the messaging, and we'll play the videos here.
Whatever. Whatever.
Blood pressure's high again.
Whatever.
Hey, you may have a lot going on, but it's dangerous to whatever your hypertension.
Damage from uncontrolled high blood pressure or hypertension builds over time. It can lead to heart attack, stroke, even dementia. Get help at mybpcontrol.org.
Whatever.
Whatever.
Blood pressure's looking high again.
Whatever.
I know you're juggling a lot, but it's dangerous to whatever your hypertension.
Uncontrolled high blood pressure or hypertension does damage you can't always see. It can lead to heart attack, stroke, even dementia. Get help at mybpcontrol.org.
So those are the PSAs, and like we mentioned, they're meant to spark that pause and think moment in the face of these inconvenient moments. We'll move on to our creator videos. We do know people are more likely to engage when messages come from voices that they trust. So having both familiar public voices and clinical expert voices helps us reach audiences in different but complementary ways, emotionally and credibly. So we'll play some of our partnerships with these trusted voices. We have 4 videos here that we'll go through.
Next month, I turn 45, and I've been learning about a topic that I did not pay attention to before. So get ready with me and let's chat about it. Do you know your blood pressure? Because I sure didn't until my last doctor's appointment. My doctor shared with me that my blood pressure was slightly elevated and that we need to keep an eye on it. So I bought an at-home machine, and then one of my very best friends was diagnosed with hypertension/high blood pressure. They mean the same thing. A normal blood pressure rating is 120/80. And if it's consistently above 130/80, that means you have high blood pressure/hypertension. And your heart is working too hard. Uncontrolled high blood pressure can harm multiple parts of your body, like your heart, your brain, your kidneys, your eyes, and more. This is absolutely between you and your healthcare professional. And you can visit mybpcontrol.org to learn more. And they have different tools and different tips and things that you can bring to your appointment with your healthcare professional.
During my first pregnancy, I had preeclampsia, and that is a condition that causes high blood pressure during pregnancy. What I learned is that having preeclampsia during pregnancy greatly increases your risk of developing high blood pressure later in life. And that's why I take knowing my numbers very seriously. So whatever your story is, if your blood pressure is consistently over 130/80, that's considered high, and that's something you should take seriously. And that starts with knowing your numbers and creating healthy habits, and sometimes working with a healthcare professional to develop a plan that works for you. If you are unsure where to start, there are tools to help. Visit mybpcontrol.org to start knowing your numbers and developing a plan that works for you.
I almost died because of a silent threat to my health. I had no idea that I was sick, so I know the importance of early intervention. I was diagnosed with pulmonary arterial hypertension in 2018 and almost died. And though my situation involved a specific type of hypertension, I learned that about half of the adults in the US have high blood pressure, and most of them don't have it under control. If your blood pressure is often higher than 130/80, that is called high blood pressure or hypertension. By keeping your blood pressure below 130/80, you can reduce your risk of serious health problems like heart attack, stroke, kidney damage, and even dementia. Knowing the signs and symptoms are incredibly important and how a personalized treatment plan is necessary. I'm kind of a control freak, and thankfully hypertension can be managed with treatment. Working with your medical provider and having open communication about your plan is crucial. Taking control of your health should start now. Visit the Hypertension Bites website at mybpcontrol.org to take your next step.
Look, I get it. High blood pressure isn't something you feel until you really, really feel it. It's actually doing this work in the background, which is one of the reasons why it's known as a silent killer. The good news, you can stop the damage even before it starts. And the goal is pretty simple, keeping that number under 130/80. Why? The higher that number is, the harder the heart has to work until it can't anymore. Treating it now is how you protect your memory, your energy, and honestly, your independence. And no, you don't have to change your entire life overnight. It's a team effort. Usually 3 things: tracking your numbers, keeping up with healthy habits, and for some of us, taking medicines. Taking a pill isn't failure. It's a tool that works with your lifestyle to keep you safe. You don't have to guess your way through this. Head over to mybpcontrol.org. They've got the tools to help you and your doctor build a plan that actually fits your life. Go check it out.
Next month,
During my
I
first
turn
pregnancy,
45.
So those were our video assets, and I know we had some questions come in, but hopefully they'll get answered as we go through the rest of our materials here. So next we'll talk about our social and digital media graphics. So we have a robust set of social media graphics. These are designed to emphasize hypertension control and reinforce the core campaign messages that we talked about earlier. So understanding risk, defining control, giving hope, and sharing a plan. The consistent call to action across these assets drives back to our website, mybpcontrol.org. They're also available in multiple sizes, so they can work across all of your platforms, from Instagram and Facebook to website banners and even email headers. Next slide. And as far as print materials, we also recognize that, not all of the engagement happens online. That's why the campaign includes print-ready materials for use at in-person events, healthcare centers, community fairs, you name it. Any engagement opportunity that happens in person, you can print these out and distribute them there. So we have posters and table tents that also reinforce campaign messages. And again, they direct back to mybpcontrol.org. And they include a QR code, which is very helpful. So for supporting journey of patients, we also have resources available to share directly with patients to support on their journey, including digital online resources and resources that can be printed to support their journey to blood pressure control. And one is our interactive BP Control Explorer chatbot, which is that first video that we played. So this is so that folks can get their immediate answers to their hypertension questions. It's such a great tool, and there are options for understanding blood pressure control basics, or for getting more information, measuring your blood pressure, implementing healthy lifestyle habits, or understanding the role of treatment and getting tips for working with healthcare professionals. So you select your responses as you go through the chatbot, and it's a really cool interactive tool. And the second video that we have here is our BP Control Plan Starter. This allows folks to enter some basic information. It has 3 simple steps, and you enter your basic information, and you enter what you're currently doing to get tips on on where they should start in their journey. So at the end, they get sort of a customized plan for control. And then at the end here, we have our control plan tracker. It's a printable journal designed to help patients actively track their progress and prepare for conversations with their healthcare professionals. So in this tracker, folks can sort of record their blood pressure readings. They can track their lifestyle changes, including their sleep, diet, and they can note their reactions to medications. And because it's printable, it's accessible. especially for people who prefer a tangible resource they can bring into the exam room. So that is really, really helpful as well. Next slide. So this is our campaign toolkit. All of the resources that we just talked about and walked through, they can be found on this one dedicated landing page, our campaign toolkit page. This is our one-stop shop for all of these resources, these graphics. It's great because it's easy to browse. You can easily download and share our videos. Also those content creator videos are also up there. We have text that you can simply copy and paste. We have social media copy, we have digital copy for your newsletters, websites. It's really, really just a gold mine for a ton of content, and it's really easy to download and share it. And like we were mentioning earlier, the resources are designed for both patients on there and then also separately for professionals working with patients. So all of that is on the campaign toolkit. So as far as our Spanish language, I know there was a question related to this. So most resources are available in Spanish. The videos are not yet available in Spanish. The graphics, however, many of the graphics are. And the goal of the Spanish language experience is to make a lot of these practical tools related to blood pressure control available to Spanish-speaking individuals and communities. So you can access the Spanish language experience at any point that you are on the website. You just go to the top right hand and you toggle to ES at the top right of the website navigation. And again, this could be on any of the website pages that toggle feature is available. So that is it for our resources.
Thank you both. I'm going to open it up to see if anyone has any questions, and I am going to allow you all to come off mute if you would like to, if you want to introduce yourselves and ask any questions. Or if you feel more comfortable typing your question in the chat box, you're welcome to do that as well. I will say, as we're waiting for questions to come in, one of the things that I, at the roundtable, love about this campaign so much is, for most of you on this fireside chat, you probably know that we at the roundtable work behind the scenes with clinicians and nonprofits, and working hard to close gaps around hypertension care to improve hypertension rates in all communities across this country, but we don't necessarily have a connection with patients and individuals. So this is such a complementary campaign to the work that we do at the Roundtable, and I am so excited to be part of this and to continue to support it because it's so incredibly important, and I know this will bring so much value to so many of our members at the Roundtable. Paris, I see you have your hand raised.
Yes, I'm so glad I came to this presentation. Great job, great job. This is exciting for me. I love making things plain for the consumer. Great toolkit, so great job, everyone. I'm a project officer, so I just want to be clear before I move forward because I'm excited. Is this available to share with recipients now? And can you speak a little bit about the rollout of this so that people really know that this is available and are using these resources?
Yes, so love that question, Paris. Thank you. The big short answer is yes with an exclamation point. It is available now. We'd love to support however we can. Really, it's a part of why we're doing these meetings. We launched recently, and there are still elements of the rollout that we're actively developing. So just to be honest there. And so right now we're at the point, and in May was where we finished the latest release of assets. So the Spanish language materials, the updated version of the toolkit. So we've been working quickly to implement content that reflects the insights. And so now that we have that body of content and assets available, we're actively working now to figure out how do we get the word out. And honestly, we're opening up to Q&A, but we actually have some questions for you as well, because that's where we need help. So we'd love any feedback or input to help us think through how can we get the roll out better. So we have some thoughts, but honestly, we welcome any and all feedback and recommendations there.
Well, I'll just say I have a call with the recipient in a few minutes, so they'll be the first to know. And I love giving them hot off the press resources that they can share with their partners who are work a lot with providers. So look forward to that. I'm happy to share more ideas.
And one other thing I'm going to do, Paris, is I'm going to put my email address and Mandip's email address in the chat, because part of what we're doing is, as part of our rollout, is we're offering to go on a road show. So we can do an abbreviated 15-minute version. We can go as short as you need it of this overview. And what we're finding is it might be better for us to go to audiences. So we can join a meeting, we can join a presentation. That's what we're going to be actively doing. And if you haven't received an email from us yet, you'll likely get one in the next month with us asking, would it be okay for us to present to your audiences so that we can get the word out? So would welcome that opportunity if it's possible.
And just to add, I know I typed in the answer in the chat box, but for those who may not be able to see the chat box, we are recording this and we are sending this out as soon as we get the link from Zoom. But please forward this to anybody that you feel would be interested in hearing this fireside chat and learning more about this campaign. So I'll pass it back over to you, Kinetra.
I want to acknowledge Modelle's question in the chat, Dr. Ogani, and it's a comment that she's made before at a meeting. So you've made it before at a meeting, and it has been top of mind as an area that we'd love to talk. So that definitely falls in that area of what can we do to do that? That's a workplace wellness and electronic medical records, EHR, any other systems. Those are a couple of areas where we love to get insight connections to figure out what can we do, what else can we develop, or what else can we do to support, because it's all free and available, and we just want to make the connections.
I think I see Anna's hand raised.
Yes, hi. I work for the New York State's Department of Health in our heart disease and stroke prevention team. And this campaign looks incredible. I'm really happy I got the chance to view this, so thank you for taking the time to present on it. I did just have one question. I know that you guys talked about talking to different community members and your guys' tailored population to see what some of these practical barriers are. And I know you guys said that you went in with this assumption and then came out with a different idea and tailored the campaign around this feedback. I'm wondering if after you guys created your campaign material, so like the PSAs and the posters and things like that, did you ever go back to your tailored community members and get feedback on them to see if it was well received?
Great question. We did that survey that I mentioned in the process. That was a testing of our creative executions. So at that point, we tested the social media, like the graphics. We tested the look and feel. We tested very specific messages, and we invited our audiences to actually compare and contrast messages. So absolutely on the messages, yes. And on the social and digital, we did not do it with the actual PSAs. So we didn't, but we tested a concept. So we had like a storyboard of the video PSAs, and we got feedback to that storyboard. And then we went into production and produced those assets.
Awesome.
Yeah.
Thank you.
If I remember, Kinetra, I was following this along as you were doing all the incredibly hard work last summer, that it was a real iterative process. You were going back and forth getting feedback from everyone as ideas were being developed, based on the continued conversations that you were having with those that were engaged.
Absolutely. Yeah. It's a great way to describe it.
Thank you.
Oh, go ahead. I actually have a question for you all around the barriers. I'm very personally interested in the barriers that you all found. And I'm wondering in your toolkits, I think I know the answer to this, but if you're a clinician, I think just understanding the different barriers is critical to how you approach that patient in that moment. You had mentioned that we all had our own assumptions going into it, but then after doing the focus groups and hearing from individuals, that change, which Anna just mentioned as well. But how are there specific tips in these toolkits for any clinician who is seeing patients so that they understand that one person's barrier is just one person, right? That everybody comes into that exam room with a different lived experience. So can you talk a little bit about some of the tips or information or context that's in these resources to help clinicians kind of break those barriers down when they engage those patients?
That's a really good question. And honestly, as you're asking it, potentially an opportunity for us, in the resources, in particular in the talk pressure guide, those insights are more embedded in the recommendations. And so the framework is the recommendation, and that's explain the risks, that is give hope, that is give a plan, and define control and address barriers. So kind of those, explain the risk, define control, give hope, share a plan. And if you hear them address barriers, those are the recommendations in the guide. One thing that we don't say explicitly, which is kind of an implicit tip, I believe, as I hear your question, all of that assumes you're asking questions and you're looking for the indicators of what those barriers might be in order to address them. Fundamentally, we're saying out of the gate, explain the risks using the information that's likely to land as new. So that's just explain the risks using what's likely to land as new, define control very clearly, and give hope, and provide that 3-plan framework. The barriers that our messages speak to are around navigating life, that there are many options to find a plan that works for you, around any resistance or stigma around treatment, if that's what the doctor recommends. And so that will take asking certain questions to get a sense of what those barriers might be.
Thank you, Kinetra. And there is a question in the chat box. So she explains she's serves as a community health specialist, and the question is regarding the My Blood Pressure Control campaign. Given the important role that self-measured blood pressure monitoring plays in hypertension management, are there plans to incorporate SMBP education and promotion into future campaign activities? And additionally, have you considered leveraging community health workers, which we love team-based care? So shout out to everyone on a team-based care who's delivering hypertension control care, but community health workers and community-based organizations to help support participant engagement and long-term adherence.
So on the latter, yes, in certain markets. So this is a campaign. Let's think of it as an umbrella campaign, and the goal is let's conduct research, let's develop recommendations and resources, and make it available to as many people as possible to support their work. And so that's what you'll see here. But we are able to, with the support of some of our sponsors, to invest in key markets. So in Metro Atlanta and in a couple of Louisiana markets in particular, we are providing funding for community health workers. We're providing additional printed materials and resources. So we're able to do that in certain markets. We would love to do it in more. So maybe if we were able to get a lot of momentum around this, there's a framework here that can be implemented at scale in markets. so that we can support community health workers in that way. We actually were just at the Georgia Community Health Workers Summit last week, sharing materials and recruiting community health workers to get them engaged, not only to get materials, but to share their stories. So there's the short answer to that there. SMBP. So right now on the web page, there is a page for, there's what is a control plan, and then there's a specific page for each part of the plan, including measure your blood pressure. So there's guidance on SMBP. We refer to existing resources like the American Medical Association's resources, American Heart Association, Release the Pressure with the American Medical Association has some great videos and guidance for SMBP. So for consumers and patients, we walk through that and we refer to existing resources that provide guidance on SMBP there. I do want to know we're running out of time, and we weren't sure how we might facilitate the working part. I mentioned I have questions for you guys, so I included our information because the recommendations that are being offered, electronic medical records, pharmacies, CHWs, part of our next step, and maybe we collaborate with you on this, Jenny, because I know the Roundtable does great work around, team-based care, SMBP. You're engaging the leaders and stakeholders around this topic is to explore opportunities to connect the dots more. If there are recommendations, if there are contacts, we're happy to follow up. And we're also happy to consider if there are places where we need to make adjustments so that they're more applicable for particular groups, particular opportunities.
We would love that. We would love to continue our conversations and have some meetings. I know I see Steve is on here, one of our co-chairs at the roundtable. So absolutely, whatever you all need from us to support this wonderful campaign, we're happy to do it and kind of bridge that gap again with all the clinicians as part of team-based care coming to the table. For those who may not know, we have a team-based task force who is very involved. So, maybe we invite you, Kinetra and Mandip, to one of our task force meetings to think about how we really can implement this and raise awareness even more nationally. But thank you all. This has been a wonderful fireside chat. This concludes our fireside chat series for this time of the year. We're going to take a little pause over this summer as travel kind of disrupts some of our working schedules. We will be back late August with another fireside chat. In the meantime, I believe Mandip put their email addresses in. Please check out these resources. I encourage you to send them to your colleagues, use them with your patients. But thank you, Kinetra. Thank you, Mandip, for the wonderful work that you put into this campaign. It truly is amazing. I can't wait to continue to promote it with all of our roundtable members. So with that, I wish everyone a wonderful afternoon. Thank you all so much, and we hope to see you at our next fireside chat late summer. Bye, everyone.